My name is Linda Golley. I would like to share my thoughts about serving as a commissioner for CCHI. I joined CCHI as a commissioner in the year 2015. From the very first day on the board, I have relished helping to build CCHI into a strong and reliable certification body. Certification of professionals involves a highly technical process. I have learned so much about validation of test questions and setting of scores, and the mechanisms for conducting the individual tests for applicants is also very complex. The value that I bring to the CCHI board lies in my background as a healthcare worker. I have taken care of patients for 40 years. I stay focused on the primary reason that we even have interpreters and health workers, which is to make healthcare better for patients. Back in the 1970s and 80s, I used to do ad hoc interpreting for my neighbors and my patients in Spanish and Russian. It was the Wild West. Like all other ad hoc interpreters, I did my best, but did a very poor job of being accurate and complete. Because of my own experience with interpreting, I was excited and delighted when healthcare interpreters began the process of professionalizing. First, they got paid for showing up. Then they started being held accountable for their performance. Since the 1990s, I have worked to mentor and train medical interpreters. CCHI is the perfect group for me to volunteer with. We encourage medical interpreters to take continuing education classes regardless of whether they are already certified or not. By providing free webinar training opportunities, CCHI complements our core mission to get interpreters certified. As a commissioner, I attend conferences to represent CCHI. It is delightful to discuss the benefits and mechanisms of certification with interpreters. Our interpreter corps here in America has very deep community roots and a huge commitment to providing good service. I love participating with CCHI's other commissioners on strategic planning for next steps in certifying healthcare interpreters. We are researching ways to test the interpreting oral performance skills of interpreters using English as a base. We call this project E2E, or English to English. We have invited many stakeholders across the country to join in this effort. In addition, we are looking down the road to creating tests to certify advanced level of practice in certain medical domains, such as mental health.